for care of the child with a urinary tract or renal disorder. So first let's talk about the different terms for urine. The first one we're going to look at is a liguria. Okay? So that is just a significant decrease in urine production. So it is lower than the normal level of urine or the normal output they normally have. Then we have anuria. So that is just absence of urine. So we are not seeing any urinary output with these patients. And then the last thing, creatinine. So you can do a serum of this to help determine urinary function, and we'll kind of talk about that here in just a little bit. So this is a product that is released in your body during muscle cell production. So this level is normally constant, but when it's less than usual, that means the kidneys are not functioning properly. So if we have a low serum level of this means our kidneys are not properly functioning. This is a table in your pituitary that gives you just the average urine output in 24 hours based on age. Okay, let's talk about diagnostic testing. So the first one I want to talk about is urine analysis. This is one of the most revealing tests for kidney function. Okay? And most of you have probably had a urine analysis, or your child's had a urine analysis. And so basically we teach them on how to give us a clean specimen, do a clean catch urine analysis to determine several things, and we're going to kind of break those down and talk about them. The first thing whenever you send a urine to lab is they inspect the urine. Okay? So that's the first part of the test. Is this urine clear? Is it cloudy? What color is it? Does it have an odor to it? So that's the first part, inspection. Then from there, they will take a special strip and dip it in the urine. And so if you look over here in this picture, you can see, so basically they would dip the urine and then they will place it against this grid and read the results. So what are some of the things that they are testing for in the urine? Well, some things are ketones. Okay, so we'll see ketones whenever we see like diabetic ketoacidosis patients. So that is in the diabetes lecture, which we'll talk about later. But just, is the urine spilling ketones? Is the urine, does it have glucose? Is your urine spilling sugar? Does your UA have protein in it? Okay, and protein can indicate one of the urinary disorders we'll talk about here in a little bit. What is the pH of the urine? Is it acidic? Is it alkaline? Are there nitrates in the urine? And then what about specific gravity? So what is specific gravity? So that tells us how hydrated the patient is. Okay? Ketones can also tell us a little bit about if they are taking in the nutrients they need as well. So specific gravity, how hydrated? Are they dehydrated? So if their level is on the higher end, that means that they are not hydrated. Okay? If it is on the lower end, that means that, or within the normal limit, of course, then that means they're going to be hydrated. So with that, a higher level means that they are dehydrated. So they dip the urine, they result what they see, okay? And then if they, based on their inspection and what they get on this, then they can place it, and then they place it under the microscope, okay? When they place it under the microscope, then they're also looking for, do we see any bacteria? Do we see any red blood cells, white blood cells? What do we see? And then from there, they'll make the decision whether they need to set it up for culture. If they think that maybe, for example, the patient has a urinary tract infection and they want to know what bacteria is causing that infection. Blood studies. There are some labs out there, and we just talked about one earlier. We talked about the urine culture. So UA, remember that UA is going to be one of your main tests for kidney function. All right, we're going to talk about urinary tract infection. So first, let's talk about the risk for urinary tract infection. Okay. So with urinary tract infection, basically a bacteria, some organism has caused an infection in the urinary tract area. So who are going to be at risk for this? Well, one would be somebody who is sexually active. Okay. Another reason, do you think males or females would be at higher risk for this? Females will be at higher risk for this. So let's think about, why would females be at a higher risk for a urinary tract infection? Well, the reason for this, think about the anatomy of a female versus the anatomy of a male. Female has a shorter distance for that bacteria to enter to cause a urinary tract infection. Okay, so that's going to put them at a higher risk. Another category that would put you at risk would be uncircumcised males. And why do we think that? So the reason why our uncircumcised males, a lot of times they might have issues with cleaning, especially because they need to pull the skin back, clean the area, and improper hygiene can put them at a higher risk. So whenever we're assessing for urinary tract infections, most of the time, we'll have burning with urination. So a child may be able to tell you it hurts when I pee. Sometimes they have fever. They have to go to the bathroom a lot because they don't feel like they can empty their bladder completely. But what about an infant? How are we going to tell if they have a urinary tract infection? So with our infants, they are a little more vague symptoms. So they're going to have fever, and they're going to be irritable, maybe not eat as well. If a child has a fever, an infant has a fever, and we have no reason or no known cause of this fever, then we're going to suspect maybe they have a urinary tract infection. So labs, we're going to do a UA, and we already talked about that. So we're going to do a UA and see if they're positive for urinary tract infection, and if so, we're going to set up a culture and figure out what is causing this urinary tract infection, what organism, because we want to make sure they're on the right antibiotics. So what do we think is one of the number one causes of urinary tract infection? One of the number one infecting organisms? E. coli. And do we know why E. coli? So let's think about where our urinary tract is and how close it is to our rectal area, where there would be E. coli. So we can teach ways to help prevent urinary tract infections. Okay, so E. coli are one of our major causes. There's some things we can do to help prevent that. And we're going to talk about those here in just a moment. So let's talk about nursing care. We're going to put these patients on an antibiotic, try to control their pain, encourage fluids, really hydrate our patients, flush out that organism. And we are going to monitor eye, nose, and we are going to educate on how to prevent these from happening again. So if you look in your ATI, you'll see how to educate. It's page 255. So some things I want to point out is wipe front to back. So we tell our female patients, wipe from the front to the back. Don't wipe from the rectal area towards the vaginal and urinary area. We want you to wipe from the front to the back. Another thing is wear cotton underwear instead of nylon underwear. Making sure you're taking in plenty of fluids on a daily basis. No bubble baths. Frequent voiding, so you're not holding that urine in for 8 hours. We're voiding frequently. And what about sexual activity? What do we tell our females? They should avoid before and after sex, but definitely after sex, okay, to help get some of those organisms away from the area that may have gotten there during sexual intercourse. So it's very important that we not only educate them on ways to prevent it, that we educate them on taking their entire antibiotic treatment. Just because they feel better does not mean that they do not finish it. And that can further cause complications, as well as the infection can come back, and it could, urinary tract infections can get very bad very quickly. So for next class, I want you to read up on urinary tract infections and be ready to go to Sim Lab.